Exactly. Exactly. So everyone, we have Armand here today and his wife. All right, as we are here for this healthcare initiative. And Armand, give us your point of view. What do you think this healthcare initiative, having it accessible for anyone, what does that mean to you? Do you have a story that maybe aligns with the need for healthcare? I mean, everyone truly usually sometimes has someone in the past that they might have gone into. They might be hereditary. There's so many different reasons. Not everyone can afford it. And even if you can afford it, money really can't buy health. Okay? Good health starts from the inside, your mind, how you feel. It can probably extend you a little bit more grace than others. But at the end of the day,
you're absolutely right. And unfortunately, being in healthcare, you have a lot of stories, right? Prior to being part of this American Rural Care Clinic and Medicare Research, I was a founder of PharmacoRx, which is one of the largest independent pharmacies was in the state of Florida. So I was servicing over 25,000 patients, and because of the type of service that we were providing was hands-on service where we were delivering medications to patients and we were providing medication therapy management at the patient homes. We saw what patients were dealing with. And then we also were able to communicate with our network of doctors, so we understood what physicians are struggling with, right? And those struggles come all the way from the Medicare itself and the measures that they set up, right? And then trickles down to MSOs and the health plans. And then, of course, it hurts the patient because they're not getting the diagnostics that they're supposed to get. They're not getting the tests they're supposed to be getting on an annual basis. Or they're literally, nobody knows what they what is it that they deal with at home, where they live by themselves.
Yes.
And there's no one to stretch their back.
Accessibility.
Absolutely. So you have no accessibility to care, you can have no accessibility, you have no transportation. You're literally, and unfortunately, some of the physicians that I speak to, and some of the demographics we service are Caribbean demographics, right? Haitian, Creole speaking demographics. And
I speak Creole, by the way.
Oh, so we're very much engaged with the community, and we see the type of struggles that the community is dealing with. Fortunately, we were able to connect a lot of those that needed services with primary care physicians that were able to penetrate through the community and be able to go out with community leaders and connect with these patients and bring them to the clinics. But there's so many that are being underserved, they have no idea. And not only that, but the medication or non-compliance is one of the biggest problems. And those non-compliance comes across the board. So, you come to the doctor, you prescribe the medication, you diagnosed with whatever it is, chronic disease, and now you have to be able to treat that chronic disease. Unfortunately, it starts at the time when they leave the doctor's office a lot of the time. So education, that being able to hold their hand, being able to get them to that positive outcome, that's very difficult. Including cultural differences, right? Because
that's
Haitian community, you can imagine, right? They rather drink tea that is made of herbal tea for blood pressure and diabetes and everything else, rather than take the medication. So you have to be able to know, understand, and educate the community in a way that they will accept.
Yes.
Just like the Cuban community, right?
Yeah, we still,
cafecito for everything, right? But it's it's very important to understand the background, the culture, so then you have the right type of approach.
Exactly. That's the only way you can reach people. The first thing is, of course, to break the cultural divide. Once you break the cultural divide, now you can reach people based on their needs and to trust you, because you have to build that trust. And if people can't trust you, then why would I want it? How many people leave the doctor's office and say, I'm not drinking this medication? The doctor's just thinking they just need to make money. That's the first thing they're going to say.
Yeah, it's unfortunate that's the reality today, and that reality is being kind of forgotten and not spoken about, and it needs to become loud. And the education is where the gap is, right? Because you're getting paid to see the patient, you're getting paid to transport the patient sometimes, you're getting paid for many different tests, but where is the education? Who is going to actually go ahead and explain to the patient that this is how you are, by taking this medication, you're going to be able to control your chronic disease. It's not going to be cured.
No.
Because they think that, they'll take 30-day supply and think they're cured.
Because
they feel better.
Yes.
But they feel better because they've been taking the medication and they just quit. Right? So it's very difficult to break through that knowledge and being able to educate. So I think that there's got to be more engagement from the healthcare community with local communities, with local leadership, with local healthcare organizations, so they're able to bring to patients what they really need day in, day out.
That's true. That's true. And you have it, and we have Armand. That's Armand's take on it, and I believe that will be a general take for everyone else. So he's dealt with the medical side, and you said healthcare. All right.
Well, Fonco actually, my previous organization now, we're building one of the most comprehensive wound care clinics as well as clinical research. So we're diving into clinical research so we can help bring new drugs, new devices to market to get them approved through the FDA, and at the same time being able to reach out to patients with chronic wounds, with wounds that need comprehensive treatment and are not getting today for one reason or the other, which is most of the time lack of coverage. So we're actually setting up a relationship right now with the community leaders in Belgrades, so we can go ahead and take patient homes and get them treated right there where they live.
That's accessibility at its greatest. But some people can't get out, and it's taken a lot for them to even leave their front door.
They don't want to. They come from work or they come from wherever they come from. They want to stay home. And then the issue is also financial issue.
Oh, that's the biggest one.
Of course. And if you have to go and you have to pay a co-payment for a specialist, or for that specific medication that you have to pay the co-payment, and you don't have enough money, and then you think, okay, what do I do with this $20? Do I spend it on food, or do I go spend it on medication? And naturally, don't take that $20 and don't take it to spend on the food or on the medication. So what happens? They end up in the hospital. And the hospital doesn't cure it. Right? They'll just, fix what needs to be fixed, and they're back to their home, and again, with the same type of issue, the same type of problem. So it's very important to be able to understand that the coverage, where the patients will be able to go to the pharmacies, the hospitals, or the doctors, and not afraid of the fact that they are not going to have enough money to pay for it, that's it. So I hope that things are going to change, and new policies are going to be adopted. Yes, that will be able to accommodate patients in need, patients underserved, so they can have that unlimited access. That's the only way.
And today, again, it's about fighting for accessibility in healthcare. So everything that Armand has said here, Dr. Armand, has said here on today, is that we have to fight for accessible healthcare, and so this is what this great initiative is about. So now we just talked about the pharmaceutical, we talked about the drug, we talked about the makeup of man, but his wife, I'm going to call her in, also we talk about on the spiritual side, because you have to first want to be well, and that starts with the thought process in the mind. So Ramon just said you have to educate them, but they have to be willing first, because you can find entrepreneurs and a lot of people here to teach someone, and it's going to happen. But when you teach them, this is something that you need.
and it doesn't work anymore at a certain point.
Mm-hmm.
So people go to special people who learn not just about positive thinking or understanding,
Right.
but doctors that have influence,
Yes.
that believe them, can also be educated and tell them about, hey, you
Right.
can live longer, you can do
Right.
this, that. You have to believe in yourself
Yes.
and see genetics, see people what they
Yes.
suffer from,
Yes.
not just physically, mentally, because some
Right.
people went through a lot of situations, wars, poverty, and
Traumas.
a lot, and the trauma gives them this bad thing.
They're wearing.
Yeah, and they, but illness can be cured. I think this, all of this what we just spoke, we can
Right.
really
It
change.
starts, actually, the healthcare starts by how you feel about yourself. Some of the stresses we have is what produces a lot of the ailments that we have, or cause a progression, a rapid progression, because we're stressed, our levels are high, we're panicking. So therefore, something that might have been, okay, the doctor says you have 2 weeks to live, or maybe a year to live.
That's what I want to.
Okay, that year has been shortened down to 2 weeks because you didn't age in that 1 week a year with worry.
I remember Armin's mom, the doctor told she can live only 5 months. She stayed 3 years, and it was a miracle. Why? Because the family was believing in
That's
her.
it.
She was believing in herself.
Mhm.
She changed her mind.
That's it.
She started reading the Bible.
Mhm.
We find out
Mhm.
she was believing and understanding.
Mhm.
Of course, she could stay
Right.
alive, but still she tried.
She fought.
Right.
And
She renewed her mind. She wanted to live.
believe it's only spiritual.
Yes.
Law, spiritual education, and we believe,
Mhm.
and of course, being around the community, like you said, knowing
Right.
cultures,
That's it.
we definitely can change people's
Yes.
lifestyle and enjoy, be happy.
That's it. That's it. So you have our take. So this is a power couple here. All right. That is on Emerging and Power on today. We truly thank you because the reach for you, you said 25,000 to your knowledge. Maybe that might have been something that you did maybe 5 years ago as a census, but today it could be a million. Your reach. You
Well,
understand
that's
what I'm
what we're trying to do. We're
Okay.
trying to be able to reach as many as possible, and not here just in this community,
Right.
right, but all over the state of Florida.
Yes.
outside the state of Florida. And you have a phenomenal group of people here. This is professionals on both sides, on healthcare, on technology.
Yes.
And when you put
Bring
that
them
together,
power.
that access becomes so much simpler, right? Because now you're going to be able to take your phone and you're going to be able to speak to a professional, healthcare professional that you need to at a time you need to.
Yes.
And you're going to be able to be educated enough in order for you to be able to connect.
Yes.
And that's another thing that we have a struggle with, right? Communities don't have that technology
That's
education.
it. Technology.
But the new generations are getting older.
Yes.
And these generations use these phones and computers
Yes.
just like any part of their body. It
Mhm.
comes natural. So that these new generations, they will have much better access using technology.
Yes.
And I think that this group here, just like you said, powerful,
Power.
that can really make difference, including the political
Yeah.
politicians
Yes.
that are in the room
Mhm.
that can take this and be the biggest cheerleaders.
Yes.
And these are the people that make this happen,
That's
where
it.
they go to Congress and you go to Senate and they push things through that make things better and make the communities healthier.
Yes, yes. And I believe if it starts in Florida, it will go and be adapted in all of the other states. Because
I agree.
once something is proven and it works, people just pick that up and it
I spoke with
continues.
my friend, she's from New York, I spoke today. The mentality of people from both cities,
Yes.
they're thinking differently.
Right, right.
We are like having this chance to enjoy
Right.
the spirit, the meditation,
Right.
the yoga, the lifestyle,
Mhm.
and plus learning more, being engaging more.
Right.
I also founder of Red Hill Society Women in Business. Every woman has a story how she communicates
That's it.
with somebody,
Yes.
tells how she reaches others.
Yes.
And I see how amazing it is. And I told my friend, and she's by the way moving, and she said, you know what, you're right. When we live in the world like we right now in Florida, and it really makes a difference.
You see how she light up? But this is what happens when purpose meets, when you meet purpose and want not only for yourself, but you want it for others. Some people always ask why. Because one of the people I can say as far as when it comes to women, We carry so much all at one time. And the last thing is yourself. You sacrifice, you do
We are cursed
everything.
now.
Okay?
You have to feel cursed.
Well,
Everybody else
that is what we
right
need
there.
to teach. But that is not taught enough as we're talking education because it starts
It's
from
called
being a little
spiritual
girl.
education.
It starts from how the father treated her growing up. It started from there. Okay? So we need to build healthy foundations. So we're here about accessible health care, but the first step of health care starts with you. It starts with renewing your mind. It starts with your makeup, your thoughts, and no, not all the doctors are there for is just to give you these pills. They're trying to give you what works. Sometimes they say try this for 30 days or 3 months and see if it works. And if it doesn't, to put something else in your hand. But now we need to have affordable health care. We talk about the co-payments and all of that. And I'm a health insurance broker, so there are plans that can give you the maximum. Okay?
Absolutely.
Thank you.
All right, thank you so much.
Amazing.
Thank you,
So
doctor.
easy with you and so much fun to share.
I'm glad. So we'll stay tuned, and I'm gonna give you this so you can follow me, and you'll be able to see it. The QR code is on Apple TV. It's also on YouTube. So it'll be on LinkedIn. The live and the audio will be on this platform. All right.
Awesome.
Okay.
We need to get together in
Yes.
Miami
Yes.
as well.
Yes. Well, I'm right in the middle. I'm in Fort Lauderdale.
Okay.
So yeah, wherever I
Right
call.
on a date
Because
doesn't
I'm
make
in a
any
group right now with a lot of the leaders from West Palm, doctors and politicians there. They always have different initiatives going on there. But this young man reached out to me. I said, "Okay, that's about it. I have to go to Texas. That's about where I have to go just to be able to hold that truth and put it on the platform for the people to be able to be accessible."
That's amazing.
All right.
Great
Thank
job.
you.
Thank you.
Thank you.
Oh, absolutely.
Good.
Hi, Carl.
Good. So today, since it's about the initiative, I just wanted to pull a few people from the crowd just to talk about the initiative and what their thoughts are about it. And
About
healthcare, making it accessible to individuals. This is what this initiative is about.
Oh, absolutely. I think that healthcare is an industry that needs to be disrupted in America, and it's not been very well managed. And I think that we need to basically have provided a healthcare system to all the people that are required, regardless of our race and what areas and state they are in, or in terms of money, class related, whatever it is. If you look at Canada, you look at London, you look at India, country like that, you have government, you have different types. So I think that they should be there. And based on that, there are multiple different services to provide better healthcare. Because in the future, the technology of healthcare is going to be far beyond where we are standing right now.
Right.
And that will be accessible to every company. That's right.
Right. Thank you so much. What about you, sir?
If I can give you an example,
Come over on this side. We don't want to ball in the back.
if I can give an example using the theater, we need to create and prepare the theater in such a way people can relate to the story. So healthcare is like that. It's a theater where doctors are the performers, patients are the judge. So they judge how the clinicians are performing. So because of this data, now AI, and which is coming from data, and we have tools to collect this data really in the future. It has the potential to make it universal. Everybody can access it because everybody has one item minimum in the mobile phone. That's the data tool. So that's where we are going. Basically, within, if I am not very wrong, maybe 20 years, healthcare will become more accessible and more affordable, as well as it will reach more population.
Right.
So that's where we are all.
So what is your stance? You are on the medical side or the technical side of it?
Technical side is always on the shoulder of some aspect of the industry.
Right.
Doctors, nurses, they don't need to struggle with technology.
Right.
And that's not right. So give them the clinical items they need to work on. Behind the scene, that's where again the theater, you have people working behind the screen. So that's where the technology is.
Yes, indeed.
Front end is patient at the now. So it is becoming so convenient, so easy. Data is so cheap.
Yes.
There should be no more barrier to make it universal.
Yeah, there
Next
shouldn't be a
one.
barrier,
Yes.
indeed. Indeed.
Unless we make a barrier.
Right. Oh, usually man does
Yes.
make the barrier.
Man
It
is
was
the
not
most
meant to be that
culprit.
exactly. Man is the culprit of all the changes that we see around us today, limiting who should have what, who shouldn't have. So it is man that is the barrier. Other than that, it's God created for everyone to be healthy and well.
And even God gives diseases also to make sure that people follow the protocols.
Okay, well, I don't know if he does that part, but we create that part. He didn't initially create it that way, but what we do, we create it, right? Again, man brings it in.
However, we have to be more diligent about our health. The engagement of the population.
Right.
That starts with education.
Yes.
I call it, we have to initiate our all awareness program from middle school up.
All the way. Yes. Indeed.
Because I'm working with a breast cancer patient.
With who?
Breast cancer patient.
Breast cancers. Okay.
He's a pioneer in that.
Oh, so you deal with oncology?
Yes.
Okay. Okay.
And one idea I'm testing is when a woman is usually suspected of having breast cancer, they have children who are going to middle school or high school.
Okay. The stresses.
Yes. No, not the stresses only, the initiation points. So if you can teach the children in high school that what is breast cancer
Right.
and how they should take care of their mom, or remind them to do a mammogram.
Okay. Okay.
Who
Okay.
should
I
be-
see where you're coming from. Prevention.
Prevention and early detection.
Yes.
These two magic words.
Yes.
Prevention and early.
It really
Yeah.
helps a lot. Prevention
I
and
just came to you and you said you can't talk.
Yeah, you should.
he will talk for me.
Okay, so that's great. So you are an oncologist or a research
Internist.
internist?
By practice of oncologist.
And what is your
defected? And I'm Dr. Zakir Sikdar.
Dr. Zaki
Sikdar.
Sigda. Okay.
So I defected to digital.
Okay.
So very early in my life, in 90s, so that's where I enjoyed doing the intersection of medicine and technology.
He had done a lot of things for the medicine. A lot of things. Lot of publications, right?
Yeah,
AI.
AI. So today we're bringing healthcare and AI together. We're bringing both of them. We're merging both together today. So that's what's in this room today. The movers and the shakers.
Yes, and also it's not only in the USA, right? It's also we are connecting the dots with worldwide.
Worldwide. Worldwide. I love that.
There's the
I'm happy that I'm in the room for the movement as far as moving forward. All right. So I'm going to leave my little flyer so you can have that. It's a platform where you can come on and talk about the emerging, as far as what is emerging. It's on YouTube, it's on Apple TV and all of that. And my main part, like I said, is about teaching, and also there are people who dealt with trauma from childhood that develop into one of these sicknesses that people have today. So it starts somewhere. If it did not come in the bloodline, it came in through the stresses or the different things that came in. Usually bloodline, yes.
and also I had children of one.
Yeah.
So I was 4 years old when I was and that has a lot of things.
So you can come actually sit like you, and I'm glad for what you're doing in the community because it's much needed, and we need that. We have to start somewhere, and then eventually we do it in Florida, and it goes through the world. We have to start.
I'm very privileged to be
In this room. It's a privilege. Yes.
We talked about all things in US outside US, how we can scale up the impact.
Scale. Yes.
Thank you.
Thank you. Thank you. Hi.
Yeah.
How you do it. It'll be easier.
Next person.
we are also podcasting really emerging in power. So we have so you can follow these QR codes. Come on, let's do this. You're the reason why I'm here. Let's do this. Put the light brighter so we just don't know. Alright, so we got in. Yes. So on today, the main reason and the main person as to why we're here today for making healthcare accessible today is here with none only but Dr. Cheryl. Dr. Cheryl is the founder. She is the brain behind this and the purpose why all of these doctors have gathered here on today. Dr. Cheryl, welcome to Emerge and Empower.
Thank you.
And it's a great initiative. I spoke to a lot of people at home, and they think it's a great thing that you're doing, and it's necessary. For some, they said we're going to start with Florida and we're going to go worldwide. For others, they said it's already worldwide. So this is the whole cause and the purpose of this. So talk to us today as to what made you feel to be a part of such an initiative.
So basically, when we work inside a long-term care, so I believe in paying it forward.
Mm-hmm.
So when I started seeing my patients, going through not a personalized care, but like an episodic care, not preventive medicine. Our long-term people now, we have to take preventive approach. But more than preventive, we're treating the symptoms.
Right.
So when we are practicing inside this can change. And technology can help us change. So much of administrative burden on physicians, so much of the burden on even nurses. I want to say any provider, any physician faces this administrative burden. So the administrative burden is taking away from care. Care is what we all came to do.
Right.
That is what made us doctors, right? So I wanted to give a personalized approach, and I thought bringing technology into this is the right solution to go. We all are saying, oh, AI is going to take away our jobs. No, I always tell physicians, AI is not going to take away your jobs. AI is not going to replace you. But physicians, those who don't adopt AI as your tool, yes, it will be replaced. It's like changing basically your A-level physician if you're going to use the technology. You can be more present with your patient rather than being absent.
Right.
The trust between physician and patients have gone down. If you look at the survey now, it's gone down so much because how many doctors, 20 minutes, how much information can you gather about your patient?
Right.
20, you're doing justice, but if your tool could provide you all the information before, so you can customize the plan. We like to customize
Customization. We customize everything else.
now. But why not healthcare? You're not seeing the individual, you're seeing it as the protocol.
Right.
But I want to see individuals. And that's the initiative.
That's great. So today we're bringing the traditional and AI together in this initiative. Okay. So that is great. So what would you like to say to other doctors and healthcare professionals out there today who are watching? What should they take from this, and how can they come back to you or reach out to you or find you?
Reach out to me on LinkedIn. I am a big advocate of artificial intelligence in healthcare, how they can assist us. As physicians, we should adopt tools. It's like adopting EMR. Back in the days, we wrote in paper, but then we transitioned to EMR. Now let's make it better. Make it what we wanted to do when we came to medicine. We wanted to do patient care. That's what we did.
That's it. And so she's on LinkedIn. Again, give the name. She's Dr. Cheryl. So I would have her information in the bio so you will be able to reach out to her. It's a great initiative. We have the Congresswoman here that's also a part of this initiative. As you've seen previously, we spoke to many doctors and business professionals on this matter. It's bringing traditional and AI together. I remember there was a time when people said, oh, I don't want to do Facebook, I don't want to do WhatsApp, I don't want to do all of this. But now they're realizing it's a necessary tool. So what she's bringing here is to make it accessible. Some people cannot leave to go to see the doctor.
Equally. We're all talking about health equity. All the good achieve is equity.
Equity.
This is not going to be achieved with people being where they are now.
Right.
If you have to go to their homes, I want to meet my patient where they are.
Right.
That means if you're at home or if you're somewhere else, I should be able to still meet you there.
Yes.
That's what it's all about. Unless if I don't achieve that, it is not going to be equally achieved.
Right.
So technology helps that.
Yes.
You know, like telemedicine, your remote patient monitoring,
Yes.
Chronic disease management platforms. All this changes your lifestyle. You're able to do predictions on how can you achieve a better lifestyle. If your cancer was predicted like 45 years for one of your family members, now we can see how we can push it by changing your lifestyle.
Right.
So that's what is the achievement.
Yes.
Health equity.
That's it. And like I said before, because I've been in medical field for 25 years working with pathology, right? In that side of the field. But now I'm on the other side of the field where it is as a healthcare broker. Why? Because there's a lot of people who don't have insurance. So now you want to make sure they know that there are plans out there, whether you're a senior, there are plans where you can even do zero monthly premiums, okay? But you can still get the health care that you need. If you have a chronic illness, there are chronic illness plans that will assist you, and also, but this is with AI, bringing AI together. A lot of times people don't want people calling them on the phone, but they're not realizing you're offering them something. You understand? But because of technology and the phones and everything, people are wary once you call them. Why are you calling me? It sounds suspicious because there's a time limit. But if they can click on that link themselves, if they can connect and telehealth themselves, if they can do all of that themselves, then they feel that they have control of what is happening in their life.
Especially having the data with you. Think about it. I think the patient should go with the data. We all our social security data, everything, right? Like that. Your information with you gives you more enlightenment to see, okay, this is what is me. I need to fix myself like this. And this is what I suggest for you to become. Adapt to these things.
Right.
I think when it's at sight, when it's out of sight, it's
out of mind.
Out of mind. But if it's inside, it's going to be there. I'm going to follow those steps. If I have reminders, small things, right? Medication reminders. All this is very important. Then your adherence to medication is good.
Right.
And then, of course, the prognosis of the disease is going to be good too.
Right.
Now you forget to take your medication, past life, people forget.
Right.
But having those reminders, having this adherence, platforms, that is what technology is for.
So you heard it here, so that's what this initiative is about. All right, so we're all the way here in Madison Green, where Dr. Cheryl has brought this initiative together, politicians, doctors, business professionals, because we need that community. It takes a community to get things done, and when we pull people together, that is the way that it will happen. So Dr. Cheryl, we thank you. She will not be a stranger here. She will continue to come on and also talk about her journey as well and her why. This is her why, but I'm sure you had a beginning before you came to your why, and that is what Emerge and Empower is about. Looking for the individuals. They're in our community. They look like us. Okay, they look like us in the community. She has a story. Everyone has a story. But today, this is her why. Accessible healthcare. Now you're bringing traditional medicine and AI technology together, all in one room for the same cause. Thank you, Dr. Cheryl.
Thank you.
All right.
I can take it from there.
Okay. And welcome Congresswoman Sheila to the set as we talk about the healthcare initiative and the reason why we are here today.
Hi everyone, thank you so much for having me. I'm Congresswoman Sheila Shuttleston-Corman, and what we're doing today is really talking about the possibilities of healthcare and how we can make sure that everyone can gain access. And AI is definitely one of those tools that we have to integrate so we can make sure everyone has access. The importance of making sure everyone has access is because everyone has a right to live with dignity and with their health. So many of us live without health care. We see a lot of our babies dying, a lot of our their mothers dying, but a lot of our family members dying from things that are avoidable.
Right.
So we're here today so we can figure out how can we leverage that and what role the government actually plays in that to make sure that everyone can be healthy so we can have strong families.
That is really a great initiative and is necessary. And I believe this step today and bringing all these individuals on is like you're bringing technology and the healthcare together. It starts with telehealth because without telehealth, a lot of people, especially during COVID, would not have been able to see the doctor because they couldn't go into the room. And so now bringing the AI together to bring all this around full circle, I know a lot of people are worried because they want to get in, they didn't want WhatsApp, they didn't want Facebook, but all of these are a tool that was necessary to get everything going.
We think about the little changes that happen in AI that's beneficial. For example, high blood pressure. Your phone now there's apps that you can actually put your finger on your phone.
Right.
Check your blood pressure. There's so many things that we can do to prevent strokes, to prevent heart attacks, to prevent diabetes. And so if we were able to have these tools at our hand and also have someone who can call you, we would have more people within 4 hours. No longer are we going to have family members who have strokes, who are now living as assisted living facilities forever. We prevent a lot of that. And as we're getting older, I think a lot of people are starting to realize that it was our generation. No one thinks that 40s will have a stroke.
Right.
The way we're actually living and the stress and trauma that we have, we are at risk. And then you think about something else like mental health. A lot of our children now have mental health issues. They have anxiety, depression. And we're seeing the suicide rates rising, especially amongst our kids. And then preventable too. We can actually start getting coping mechanisms. And I always talk about, we have to be aware of cultural conflicts. Having a provider who understands you, understands your background, and who makes you come down enough to say, I feel anxious. I remember when I was growing up and I tried to talk to my parents about feeling anxious, and they were like, "Is that anxious?"
Let's all keep playing.
It's like, "I go fat." I don't know, tell me to go read a book. But reality is, life is different. Stress is different. Social media, the immediacy of much. So we have a responsibility in this moment to do what we have to do for our generations to have everyone living a better life.
Yes, yes. So we do thank you for that and being here for this initiative because I believe this will be one of many as we rally and just keep bringing individuals together. And as you know, if you don't know already, she is of Haitian descent, just like me, from Zaventem. And so we truly thank you for being here on the set. And like I said to everybody earlier, I am just starstruck. It's a blessing.
Yeah, I'm starstruck. Look how beautiful she is.
I got the program for the last year, and that gave me the opportunity to go to Texas to be with Miss Cross America. So now I hold the title and the very first one of Florida Ultimate Woman because I'm over 50. Oh, we yeah. And I just decided to do it because, and that's why I have many books that I'm about to write book 3, is because I wanted to. And my mom was a 71 woman and needs it. So, sick, café, defect. So I was writing about that, and it helped other people to heal, and that helped me with the young, especially the young women in the community. Nobody talks about these type of traumas, and so that's what this platform is about. So people find out who has emerged, and they share it, so people find it relatable. People think if you're silent and you don't talk about it, it's gone, but actually it continues a cycle.
She is a doctor who specializes in trauma, counseling. She's excellent. I think she has a great attitude. She was even talking about naturally, we talking about our cultural competency.
Yes.
How we can still preserve our Caribbean culture and the healing of our food, to our dancing, and hanging out and family. And it's awesome because a lot of times when I talk to women, they're thinking they have to do the therapy of our culture.
Right, that's what they think.
To us.
Yeah.
Even if it's not,
Yes.
it's salad. It's not that I say how much it is, that's not it. But then again, eating the fish that
Yes.
you know, you can still have talent by eating those things.
Right.
You know, Western culture is going to tell you to reject that and have salad.
Yeah.
When realistically, like even if people have salad, so there's ways that we can preserve our culture and really as Caribbean people
great. That would be great. Because I just want to be, because for right now, I've just been doing it within the churches. I've gone and I spoke to like women's conferences, bringing awareness, just how people feel comfortable to talk about it. You know, a lot of people are going through trauma and they're in the house and, you know, like, don't they build the thing, don't they play, you know, keep on them, so I'm free, but people don't understand trauma is very deep. Yes.
I'm so proud of you.
Thank you. I'm proud of you.
What you proud of?
Yeah.
Okay.
And so, founder and CEO of ADAR Health. Okay, let's talk to us about ADAR Health.
ADAR is a digital medicine company. We built a medical device that measures your overall health in 30 seconds. And we use that and our platform to help monitor vulnerable patients, especially like people who are living in long-term care, to monitor their health every day, and also to help predict any kind of adverse event at a very early stage.
Wow. That sounds big. So whether they're in at home or whether they're in healthcare, how does it work? Is it accessible to them at home?
Absolutely. I think the whole point is like I built a device to help monitor my mom's health. Okay, she was in a nursing home and she was at home. So essentially, this is a device that can span across the whole spectrum, even in the hospital setting.
Okay.
So we wanted to be like inclusive. We want to make sure that everyone who's any kind of social activity demographic should be able to use it. Okay, so that's why it's like cost effective, simple to use, and actually measures.
So it is a device or
It's a physical device. It's more like a breathalyzer. You breathe into it. So it measures your temperature, blood pressure, ECG, oxygen sat, like around 12 health parameters under a minute.
So now you hear it. So this is what is here in this community right now. Now, is it local in Florida or is it already?
We're a company which is a Johns Hopkins spin-off company based in Maryland. But we actually deployed in like Port St. Lucie, in West Palm Beach, we're going to Miami, we're also in Orlando. So we're doing a lot of these deployments in Florida where we see a lot of these facilities need. Real-time care. That's why we provide our device and technology, and we work with the physicians to monitor the patients 24/7.
That sounds great, and I like what you said because you wanted to monitor your mom. So that was a journey for you to see what can help treat her.
Yeah, absolutely. I mean, she has been the inspiration from everything what we've done.
That's the purpose here. It says emerge and empower. You have to go through something and find a purpose. And now you turn that into something that not only helps your mom, but it also helps the community.
Absolutely. That's the whole point. I think everyone focus on like building the next app or the next wearable, which is expensive, right? Cannot be accessible for people like in different communities, right? Which is what we want, something that's simple, that you can use every day. It's more like a check engine, like Wikileaks.
Yes. Great. I love that. So thank you so much for stepping here, and I will also reach out to you. Absolutely. These are ways that you can find out more about the podcast. The podcast actually brings on individuals who have gone through traumatic experience. Some is childhood, some is health, some is divorce. So everybody's trauma is different, but at the end of the day, they live and they talk about what they have experienced. And so that way it will help other individuals who might be facing that same predicament and say, you know what, there's hope. Because this person got through it, or there are things available, like this medical device, that can help narrow that for the individual. So I want to thank you so much for your time.
Thank you so much. It's a pleasure meeting you.
Thank you.
Thanks for all what you do.
Thank you.